Okay, we are going to be demonstrating applying oxygen and then in teaching an incentive spirometer. Then we're going to demonstrate the oxygen on the wall, demonstrate the oxygen on a tank, and then we're also going to be showing how to DC the oxygen from our client. And so this morning, during morning vital signs, the person that was taking the vital signs came and reported that the patient's or the client's O2 sats were 89%, that they had straightened them up, had raised the head of the bed, had them take some deep breaths, but that their O2 sats were still at an 89%. So I'm going to be at the nurse's station. I'm going to be looking at my doctor's orders. And so I've got Anna Taylor, date of birth 4/24/1991, no known drug allergies. And I've already looked at what I'm supposed to be doing today, but since they talked about the O2 sats were at 89%, I'm going to look specifically, and it says apply oxygen 2 liters per minute via nasal cannula continuously to keep O2 sats greater than 92%. Now I've also checked the ABGs, and so the ABGs, arterial blood gases, in my chart, because that's going to help us help the doctor determine what device that we're going to be using, but also the liters per minute that needs to get the ABGs into a normal range. And so we've already checked that. I've checked my doctor's orders for the delivery device, which is nasal cannula, and the liters per minute is going to be 2 liters per minute. And then it also says that I need to teach the incentive spirometer and have performed 5 to 10 times every 1 to 2 hours while awake. Okay, so now that I've done that, I'm going to go ahead and go to the supply room. And in the supply room, I'm going to make sure that I have all of my supplies. Now we're going to be using the oxygen tank in a little bit. So I've got my tank. It's secured properly. We'll go back over that in a minute, but I know I've got oxygen. It's silver and green, and it also says oxygen on the label right here. And then I've got my regulator and a key to turn it on. So I will be using that in a little bit. I also will have my incentive spirometer. We've got a Christmas tree. We've got our water-soluble lubricant. I've got my stethoscope. I've got my nasal cannula, which is the device that the doctor has ordered for it. And then we also have oxygen in use. At the hospital, they don't necessarily post these anymore because all of the rooms have oxygen. But if I were going to be setting oxygen at my client's house, at home, or maybe in a long-term care facility, we need to put oxygen on the door so anybody coming in knows that they can't smoke, okay? And we would put the oxygen above their bed so everybody knows that there is oxygen in use. But we won't need that necessarily here. And so I've got my stethoscope, I've got my pulse ox, and I've got some alcohol swabs in my pocket here, okay? So I'm going to go ahead and gather all of my supplies. Okay, and I'm going to go ahead and go to the patient's room. We're going to need this oxygen tank here in just a little bit. I'm going to set everything down. And I'm going to do my medical hand wash. Good morning, my name is Jan Bucks-Kemper. I'm a registered nurse. And we've got a couple of things. We need to put some oxygen on you. But before we get started, I had shut down my computer at the nurse's station, and I'm going to open it back up in the patient's room. And can you tell me your name and date of birth? Okay, Anna Taylor, date of birth 4/24/1991. Are you allergic to any kind of medications? No? Okay. And I've got Anna Taylor, date of birth 4/24/1991, no known drug allergies. This morning, when they took your vital signs, your your O2 sats was 89%, and the doctor wants us to keep it above 92%. So I'm going to go ahead and get you sitting up. I'm going to raise the bed up to a good working height. While I'm doing this, I'm also also going to be assessing my patient. And so I'm looking for any kind of respiratory distress, any problems. So hypoxia, which would be bluing of the lips, and that's a late sign, bluing of the nail beds here, and if they're having any kind of dyspnea, which they just can't get their breath, even just talking is short of breath. I'm going to be looking to see if their respiratory rate, the tachypnea, is increased. We're also going to be looking to see if you have any, you're using any accessory muscles. You're using your abdomen and your muscles up here to help you breathe. Also nasal flaring, if you've got any of that going on. And then I'm going to also have you see if I can hear any gurgling, or if they're having any problems with secretions, airway patency, and if they are, just kind of have them cough with that. Okay. All right, so we're going to go ahead and put this pulse ox on you, and so that's going to tell me your pulse rate. And so while I'm doing this, because I'm fixing to expose my patient, I'm going to be I've been explaining to the patient, and I've been explaining to the family as we've been doing this, and we've provided for privacy. Okay, so your oxygen sat is still at 89%, and your heart rate is at 98. Okay, so we're going to go ahead and do a full respiratory assessment. Dispose of my trash here in just a little bit. Okay, so I'm going to put your hand over your chest, and I'm going to count your respirations. And so with the respirations, we're going to be looking at the rate and the depth, and also the rhythm. And so because you're breathing fast, if it's irregular or regular, of course 30 seconds, or if it's going to be the 20, okay, so I'm going to go ahead and count, because it is a little fast. It's shallow right now. It is regular, but I'm going to go ahead and count for a full minute. Okay, so it's at 20, which is at the very top of the rate. So the rhythm, again, was regular, and the depth was a little shallow, and then the, so rate, rhythm, and depth, okay? And so now we're going to go ahead, and I've already cleaned my stethoscope, so we're going to listen to your lung sounds. And I'm going to be exposing you. We've already provided for privacy, okay? So I just need you to breathe regularly here. Okay. Okay, I need you to take a deep breath in and out for me. Take a deep breath in and out. Take a deep breath in and out. Take a deep breath in and out. Make sure where our lung is. Deep breath in and out. Deep breath in and out. Okay, I'm going to listen to your laterals. Deep breath in and out. 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 Okay. And then I'm going to get you to sit forward for me. Okay. Just breathe normally. Okay, take a deep breath in and out. Take a deep breath in and out. 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 Okay. All right, let's get you covered back up there. So now that we've done your oxygen, I'm going to make sure that, get this stuff out of the way here for a second. The other thing I'm going to be checking is we need to look at your skin integrity. So I'm going to be looking in your nose, okay, and I'm going to be looking behind your ears, okay. Now I don't necessarily have to have gloves on. I could have put gloves on if my patient maybe had pneumonia, but they have COPD. So if they had pneumonia, then I would have to have the proper PPE on in order to do that. But I didn't need to do that, and I'm not touching. But I am checking the skin integrity everywhere that the nasal cannula is going to be on. Okay, so I'm going to go ahead and come over and I make sure at the hospital you have to engage, so you have to push that in. It does say oxygen here, and so I'm going to go ahead and now do my 5 rights, 3 checks. So I'm going to make sure I have all of my supplies here. Okay. Okay, so I've got Anna Taylor, date of birth 4/24/1991, no known drug allergies, okay. I have oxygen. Now oxygen is not on the MAR, so I'm reading this from the doctor's orders, okay. But it is still a medication, so we have to do our 5 rights. So apply oxygen 2 liters per minute via nasal cannula continuously to keep O2 sats greater than 92%, okay. So I'm going to come over here, and I know I've got oxygen. I'm going to turn this on. And we're going to set this to 2 liters. Okay, so there's my line for the 2. The ball should be hovering half above and half below. Okay? And then I've got my nasal cannula, and I will be attaching that here shortly. So this is my nasal cannula. It's going to be, so 2 liters per minute, it's going to be nasal cannula continuously to keep the O2 sats greater than 92%, okay? And so once we've got that set so y'all can hear me, I'm going to go ahead and turn this off. Okay? And so that was my first check. My second check is I'm Anna Taylor, date of birth 4/24/1991, no known drug allergies. Apply oxygen 2 liters per minute via nasal cannula continuously to keep O2 sat greater than 92%. Okay, so I've got my oxygen. We've already set it. I'm just double checking to make sure it's still floating at the 2 liters per minute. I've got my nasal cannula. It's going to be continuously to keep the O2 sats greater than 92%. That is my second check. I'm going to do my third check. Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have applied oxygen 2 liters per minute via nasal cannula, continuously to keep O2 sats greater than 92%. Okay, so I have my oxygen, and it is set at the 2 liters. The ball is still floating halfway. And I've got my nasal cannula, and it's going to be continuously. So my order does not show to do the humidification, but I do want to point out that if you did do humidification, the only variance is I would still go through the whole thing. This is sterile water, okay? According to the policy and procedure, it would be up here to the max line, and then it has a line down there that says to refill, okay? But once it gets down to this, you take this off. So according to policy, how long is this good for? And then when do we change it? If it's less than that, we would change it before that. So I'm going to date, time, and initial this. And if this had a Christmas tree, and so you just put that on. And then I would connect it, my oxygen, right here, okay, my nasal cannula. And then when I have this on, I want to make sure I have to have it above 4 liters, okay? So if you're using humidification, it has to be 4 liters or more via nasal cannula, and I want to make sure that it is bubbling, okay? So again, 4 liters or more with humidification, and you want to make sure that it's bubbling when I connect this, okay? And then I would make sure that I can feel the oxygen coming through here before I actually put it on my patient. You never put the oxygen on a patient without the oxygen going. You never take it off without the oxygen going, okay? But my order doesn't say humidification, but you may have an order that says humidification. And then I would be checking this every 2 hours to make sure that it's still bubbling and then it's still in there. But since I am not using humidification, I'm going to put what they call the Christmas tree on. Okay, and we still have it set at 2 liters. Okay, because that's what our order says is the 2 liters. And then we are going to check to make sure the oxygen is flowing. So whether we have the humidification, after we've made sure it's bubbling and we make sure it's coming out through the nares here, or through the prongs. The prongs, you want them to go with the nasal passages. So we're going to place them with the prongs going down, okay, and we've already assessed their nares. I'm going to put these on. I'll get that up over your ear. Okay, then I'm going to adjust it here so it stays on, and then I'm going to make sure that I've got plenty of room here so that as they're moving around, it's not pulling on my patient. And so once we've got the oxygen on, now we're going to go ahead and recheck our, so we've done our 5 rides, we've made sure it's flowing at 2 liters. It's flowing through the nostril, and so it's 2 liters per nasal cannula. And so we're going to go ahead and we make sure that it's bubbling. And now I'm going to go ahead and do my my next respiratory assessment. And I should already see that it's getting better. That's our expected. So I'm looking at my pulse ox. My pulse ox shows that it is at 94%, so that's good. We've got the oxygen going, 92%. And actually it's kind of helped decrease the pulse rate from 98 to 85. So that has already benefited that. And so I'm going to go ahead and do my, again, with there being regular rhythm, I'm going to go ahead and do my assessment for 30 seconds this time. So I've got my arm across the chest, and we're going to count for 30 seconds. Okay, so my rate is 16, so it was 20. So the oxygen has already started helping with the rate, and the rhythm is still regular, and the depth is regular now. It's not quite as shallow as it was, so it's regular now, okay? So we've looked at the heart rate, O2 sats, pulse rate, and we're going to go ahead and do our respiratory assessment again, making sure we have privacy. Okay, I need you to take a deep breath in and out for me. Deep breath in and out. 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 Making sure I'm not below the deep breath in and out. Listen to your laterals, in and out. Deep in and out. In and out. In and out. Okay. All right, I'm going to need you to sit up again for me. Are you doing okay? Okay, so I do hear some wheezing. Okay, deep breath in and out. 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 Okay, so I am hearing some expiratory wheezing, and so this oxygen is going to help with that. Okay, so now that we've got all that done, I'm going to come make sure that, so we've got your oxygen on, okay, and then the other thing we need to do now is, if I had any gloves on, I take those off if I need to. So once we've got that, every 2 hours we're going to be coming in and checking. So I'm going to be checking the skin integrity to make sure that there's not anything that's not pressing down, especially if you have glasses. You don't want it pressing down and causing any kind of skin problems. So we could put some 4x4s there. I'm going to check your nose to make sure. I'm going to check to make sure my delivery device is flowing. I'm going to make sure that it's still set at my 2 liters per minute. And now sometimes that oxygen can be very drying to the nose, typically 2 not, but So I've got some water-soluble lubricant here, and so you can just put that up around there. You can't use petroleum-based, but you can use this. If you need to use this in your nose or around your mouth to kind of keep it moist, okay? And you don't want to use a wool blanket, just a cotton blanket, okay? Because no smoking, because we don't want to have a fire and that can all ignite that, okay? And again, your oxygen O2 sat is 94, and the pulse rate is at 85. So that is good. So every 2 hours we're going to be checking. A lot of times you want to come in, patient may turn, one of the is over here, so we always want to adjust it to make sure both prongs are inside the nose, okay? And we're going to be checking for, especially if they have an oxygen mask on, make sure that they're not gagging or retching or even having nausea and vomiting going on with that. And then every 4 hours we're going to be checking the doctor's orders to see if he's got another ABG, and then we would check those labs, the ABGs, to make sure that this oxygen, the nasal cannula at 2 liters, is keeping your arterial blood gases where they need to be. And if they weren't, we would report that to the physician, okay? And if it was, then he would tell us if we needed to change the delivery device and or change the liters per minute on that. Okay, so the other thing that we're going to be doing is I need to teach you about the incentive spirometer. And so I'm going to be showing you how to do this. One of the things I need to ask is, are you in any pain? On a scale of 0 to 10, 0 being no pain, 10 being the most pain, are you in any pain? No? Okay. And so if they were going to have surgery, we need to teach them the incentive spirometer before they go to surgery, because they won't be willing to learn afterwards. If they've had surgery already, then we need to get them a pillow, an extra pillow to put over the incision to help splint it, and that will help them to take a deep breath. Because what we're wanting them to do is to be able to open up these alveoli. So what I want you to do is you're going to hold this in your hand here, okay? And based on if we did a again, sometimes it's set for like age and sex on how the lungs should expand here. So, but what I want you to do is I want you to focus on this best, better, or good. So as you're breathing, when we take a deep breath, you want this little yellow thing to flutter between the best, better, and good, okay? So go ahead and take a regular breath, breathe it out. You're going to put this in your mouth, okay? And you're going to seal your lips around this, and you're going to breathe in as long and as deep as you can. Again, slowly, so that this is fluttering right here. I'm going to pay attention to this over here. So I'm going to, so this is what I want you to do. I'm not going to put this in there, but so we're going to, so you would put this in your mouth, and you're going to go as long as you can. You're going to hold it for 3 seconds, and then you're going to breathe normally, okay? Again, that's slow, deep as you can, watching this to this flutter, and then I'm going to watch this come up right here, okay? And then I want you to take a couple of regular breaths, and I want to make sure you're not feeling lightheaded, because if you just did this one after the other, you're going to get lightheaded, a little dizzy, okay? You're not, okay? So the doctor has ordered for you to do this 5 to 10 times every 1 to 2 hours. So at the top of the hour, it's going to be sitting right here on your table, and you're going to pick it up and you're going to do that, okay? So let's do that again. Put that in your mouth, okay? And you're going to exhale, put this in your mouth as slow and as deep as you can, watching this flutter right here, okay? Hold it for 3 seconds, take this out of your mouth, exhale, take a couple of breaths, and do it again, okay? You got that? All right. So again, we're going to do that 5 to 10 times every 1 to 2 hours while you're awake, all right? And your family can kind of help remind you to do that. And then we're going to take this over And we would wash this with soap and water just to make sure we've got it clean for you, okay? So here's your that. So once we've taught that, if I had gloves on, I would take those gloves off. I'm going to do my medical hand wash, and then I'm going to go over, I'm going to make sure the bed is in the lowest position. Side rails up ×2, the wheels are locked. And are you comfortable with that? We're not going to lay you all the way back, but we'll just put you in a low Fowler's, and you're doing okay with that? Okay, we'll be monitoring that. So I'm going to go over here and I'm going to be documenting. So what I'm going to be documenting is if the identified, we're going to identify, we're going to report, and we're going to document the expected, which the expected was that your respiration rate and pulse and breathing got much easier, which it did. But if there was anything unexpected, then we would need to make sure we're reporting that to the healthcare professional team, the doctor, and making sure we know what your response is to that. I'm going to be documenting what your assessment was prior to and what your assessment was afterwards, which included the heart rate, the O2 sats, your rate, rhythm, and depth of your respirations, and then what your lung sounds. And so we did hear the, which is not, we did hear the wheezing on exhalation, okay? And then that we did 2 liters per nasal cannula. It's continuously. That you had your skin integrity was intact, and that you had a good response overall. So decreased respirations, decreased pulse rate, your breathing, you're not having as much dyspnea as you were before. So those are the things that we are going to be looking at, okay? So as I finish, I've got make sure the bed's low position, side rails up ×2. We just demonstrated the this. Now, the one thing I didn't talk about was if you do have, when you're checking your oxygen, when you come in 2 hours, and some oxygen devices have a tubing like this. Well, what happens is it's connected here, and then it's connected to the patient. Water will accumulate down in here, so humidification will accumulate in here. A lot of times you'll hear this pop, 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 pop. Well, we need to assess to make sure there's not any of that. We would discontinue, take it off the patient, empty that, reconnect the oxygen, put it back on our patient if we did have fluid in our tubing here. Okay, so I finished documentation, bed's ready, and so I'm going to go ahead and if you don't need anything, but if you do, put your call out on, and then again, we'll be coming in and checking on you to make sure that this oxygen is still keeping your O2 sats greater than 92%, okay? And so I'm going to leave the room and wash my hands as I leave the room. Knock, knock, knock. Good morning. My name is Jan Bucks-Kemper. I'm a registered nurse, and let me wash my hands real quick. And so we've got a procedure, but just let me go ahead and pull my chart up here. And so can you tell me your name and date of birth? Anna Taylor, date of birth 4/24/1991. Dr. Potter, and any allergies? No drug allergies. And I've got Anna Taylor, date of birth 4/24/1991, no known drug allergies. Okay, so Miss Taylor, the doctor is going to send you down to radiology for an MRI, and so since you're still on oxygen, we're going to go ahead and transfer your oxygen to the oxygen tank right here. And so first thing I'm going to do, and a lot of times you're going to set this oxygen tank up outside the room, but so you can see what we're doing. So I need to make sure that I have oxygen. So oxygen is green. Usually it can be a completely green tank, or it may be green and silver, but it will say oxygen on it as well, okay? And I need to make sure that I have the correct kind of regulator that I have. Some of them, if they don't have a little deal here, you may need to put a Christmas tree on there. But with this, so we've made sure that we've got the right tank, okay? I need to make sure I have the right regulator, okay? This, you can see, has two little prongs. The prongs are side by side. When I look at my oxygen tank, I will note that the prongs are side by side, okay? And then it has right here, it has that part right there fixed in right there. And it should have a seal. We always want to make sure it has a seal. If it doesn't have a seal, then when you open this up, it's going to leak, okay? And that could potentially cause a fire. We want to make sure that our tank is securely secure, because if this fell over and this happened to break off, this could act like a missile and go through every one of these walls until all the compressed air in there is released. So we always want to make sure, don't ever see one just sitting up there. Lay it down, but it needs to be secure. Okay, so this one is secure. And so I need to make sure I've got the right regulator, okay, which I do. And I need to make sure that I have it goes up to the number of liters per minute that I need. This particular one is a pulse, and then this one is continuous. Our order says 2 liters per minute continuous, so we know we've got the right regulator. And a lot of times they use these pulsating ones for, like at the nursing home, so it set at the liters per minute, but it actually responds to when the patient takes, or client takes a breath, it actually gives them oxygen. It's kind of conservatory. All right, so I want to make sure that, so this is where the prongs go in. This is where the oxygen is going to come out. I want to make sure it's not facing towards me or to the patient or anybody else. And we're going to do what we call crack the tank, okay? And so you're just going, it's righty-tighty, loosey, okay? And so just to get any kind of debris out, just a quick on and off, okay? Even if this was brand new, it would have a seal on it, okay? So once we've done that, we've cracked the tank. You always want to make sure this key is always with your tank. And then I'm going to make sure I do not force this on, okay? And I'm going to tighten it. I'm not going to tie it so tight, but I'm going to tighten it on there good, okay? And then I need to go ahead and turn it on again, so lefty-loosey, okay? And then what I need to do is I need to check, move this around. I'm checking to see what the PSI is, okay? My patient's going down to radiology for MRI. I need to make sure that my PSI is, that it is a full tank, okay? So a full tank is, the green is at 3,000, okay? And then it has in the red. But I want to make sure I have a full tank because my patient may be down there for a couple of hours. So that's going to tell me how much is in my tank. Then I need to, with this one, I'm going to dial it to, and then our order says for 2 liters, so I'm going to have the 2 liters, and it is working right there, okay? So once I've got this ready, okay, so I've checked to make sure that I've got the correct tank, it's secured. We've already cracked the tank, we've put the right regulator on there, we made sure we had a seal on there. If you didn't have that seal, it would leak right through here. And that is not the best thing we want to do, okay? This one doesn't necessarily have to have a Christmas tree on it because it's got a place for the nasal cannula, okay? All right, so now I'm going to go, I've got to go back to my doctor's orders. And I've got Anna Taylor, date of birth, 4/24/1991, no known drug allergies. And I've got apply oxygen 2 liters per minute via nasal cannula. Okay, let me start that. Anna Taylor, date of birth 4/24/1991, no known drug allergies. Apply oxygen 2 liters per minute via nasal cannula continuously to keep O2 sats greater than 92%, okay? And I've got my oxygen, it says oxygen, and I've set it for 2 liters per nasal cannula, and I'm going to be, this is my nasal cannula, and it's going to be continuous to keep that pulse, the O2 sat greater than 92%. Okay, I've got Anna Taylor, date of birth 4/24/1991, no known drug allergies. I've got apply oxygen 2 liters per minute via nasal cannula continuously to keep O2 sats greater than 92%. Okay, so I've got my oxygen. It says oxygen right here on it, and I've set it for 2 liters per minute, and I've got it's going to be on my nasal cannula, and it's going to be continuously to keep that O2 sat greater than 92%, okay? Anna Taylor, date of birth 4/24/1991, no known drug allergies. I've got apply oxygen 2 liters per minute via nasal cannula continuously to keep O2 sats greater than 92%. So again, I've got my oxygen, it says oxygen. I've set it for 2 liters per minute. It's flowing, it's going to be per nasal cannula, and it's going to be continuously. Okay, so now that I've done my 3rd check on my med, now I'm going to make sure that it is flowing, okay, before I connect. So my oxygen is already flowing, and every time I come in, I've checked to make sure it's at the 2 liters. So this oxygen is flowing, and I'm going to quickly make sure I've got all of this, and I'm going to transfer it to right here. Okay, once I have it on here, then I need to come up here, and I'm just going to remove this for just a second so I can make sure that the air is blowing, and then we're going to put it back on, okay? And then we're going to get ready to send you down to x-ray, and so we've got everything flowing correctly. So we did the 2 liters per minute, and we've disconnected it, connected it to here. Make sure that there's plenty of room so it's not tugging anywhere. And I'm going to go ahead and turn my wall mount down to 0 so it's not continuously flowing while I don't have it connected to my patient. If I were going to reconnect it, I would make sure that was go through my 5 rights 3 checks again, make sure I've got it set before I changed it from here to here, and then I would need to make sure that it's flowing. So whichever one you're doing, you got to do that, and then because it's got to be flowing before you put that on. Okay, so we've got that done, and so they've come back from the MRI, and your oxygen sat has been staying at 94 to 96%, okay? And so we're going to go ahead and discontinue your oxygen because the order says to DC the oxygen when O2 sats stay above 92%. And so they have been above 92% since even when you went down and you came back, and so we're ready to go ahead and remove the oxygen. So before I do that, I'm going to go ahead and I'm still in the room, and so we really hadn't changed the patient's location at this point, just showing this part, but I'm going to wash my hands. And so I'm still with the patient. I'm not going to re-identify because we've already been with them. But if they had left and came back, when I come in the room, wash my hands, I would have to re-identify my patient. So, but I was with them the whole time with when they went down for that. So, so I'm going to go ahead and put this pulse ox on. Okay, and so again, it's showing that it is at 96%. Okay. And I'm going to go ahead, and your heart rate is still at 85, which is good. I'm going to take your arm and I'm going to put it across here, and I'm going to check your, okay, so I'm going to check your rate, rhythm, and depth, okay? Your rhythm is regular, so I'm going to go ahead and count for 30 seconds. Okay, your respiratory rate is 16, which is good, within the normal limits. Your regular rhythm and regular depth in there, so it's working on that. And I'm going to go ahead and do a full respiratory assessment on your lungs. Okay, so we've provided for privacy. So just before, we're going to take regular breaths. Okay, take a deep breath in and out. 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 Okay, take a deep breath in and out. Make sure I'm still above the ribs. Take a deep breath in and out. Okay, let's check your laterals. Deep breath in and out. 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 Okay, we're going to do your posterior, so I'm going to need you, I'm going to raise your bed up just a little bit here. Okay. Okay. You doing okay? Head's kind of coming to the side here. There we go. Okay. Okay, take a deep breath in and out. Take a deep breath in and out. Deep breath in and out. Deep breath in and out. Okay. All right, your lungs sound a lot better, so that's good. Okay, so now that we've taken the oxygen off, we're going to, we want to make sure that we remove the oxygen first, okay? So I'm going to go ahead and remove this, and I'm going to disconnect it here. And if we were if we were taking it off and it was at the wall, you're just going to wrap that around right there, because we may need to have it if the O2 sats don't stay up. And so I've made sure this is off, okay? And on the tank, I'm going to need to switch out of, yes. So now I need to turn the tank off, okay? So we made sure that the oxygen was still flowing before we take it off, okay? So it was still flowing, it was still set, and now I need to turn the tank off, okay? So I'm going to turn this to off, and then I'm going to turn my tank so righty-tighty. And then once I've done that, I'm going to go ahead and open up the tank, and I want to make sure that I bleed so the dial will go down to the 0, so it takes pressure off of this off of the regulator, okay? You can hear that too, that's with the pulsating one. So it's actually decreased down, so it's off, and I'm gonna go ahead and completely, it's still off, and I'm going to turn this to the off button, and make sure you always keep the key with the tank. You don't have to take this off because this is ready to go for the next person. They would just need to make sure they know how much, they would check the PSI in there before they use it, okay? But if I were, you can just take this off if we need to change it to a different tank. And we're going to get ready to take that out. And so then I'm going to come back over to my patient, and I need to follow up. So we just took the oxygen off, so we do assessment before and we do assessment afterwards. So I've got my pulse ox, and it is still showing 96%, so that's good. So they're on 96% on room air. The pulse rate is still at 85, so that is good. And I'm going to go ahead and take the hand and I'm going to put it over the chest, and then I'm going to check my, it's regular, so I'm going to go ahead and count for 30 seconds. Okay, it was 8 times 2, so 16 per minute, regular rhythm, regular depth, okay, so that's good. And then we're going to go ahead and do another assessment, lung assessment. I have to pick up my trash. So again, we've provided for privacy. Let's just straight up here a little bit. Okay, I need you to take a deep breath for me. In and out. Deep breath 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 in and out. Making sure I'm not too low. Deep breath in and out. Deep breath in and out. Checking the laterals. Deep breath in and out. Deep breath in and out. Okay. And I'm going to need you to sit up again. I need to get help in here. We could get help. I'm not hearing any more wheezing. Okay, can you take a deep breath for me? Okay. A deep breath. Deep breath. Deep breath. Deep breath. And one more deep breath. Okay, well, let's get you sitting up here so we've got some good body alignment going on. Okay, so we're still at 96%, so that's excellent. Okay, take that off, put that in my pocket. We didn't raise the bed up, but it was where I could still get to you. Okay, so we've talked about how to turn your oxygen off, turn the wall off. We've done our assessment. And so now, make sure our bed's in a low position, side rails up ×2. I'm just going to lay you back just a little bit, okay, and just make sure that you're still able to breathe okay. Wheels are locked, call lights within reach, okay. And I'm going to come over here and I'm going to document. So while I was doing this, I was identifying anything that unexpected that I need to report and also document. And everything seems to be going fine right now. So I'm going to be documenting what your full respiratory assessment was before we took it off and what your full respiratory assessment was when we de-seed the oxygen. We are going to make sure that once we take, and every 2 hours we were checking to make sure the skin integrity, so just making sure we still didn't have any redness around any of the ears and in the nose, or maybe even where that was applied right there. And so the skin integrity is still intact and you're doing well. So your response to the oxygen is that your O2 sats are staying up, you're not having any kind of dyspnea or any respiratory distress. So those are all the good things. So I've documented all of that, and I'm going to go ahead and shut my computer down, and as I get ready to leave the room, then I'm going to go ahead and make sure you don't need anything. You don't need anything, okay? I'm going to put this in the trash, and then as I leave, I'm going to take my oxygen tank with me and do a medical hand wash. And again, if you don't need anything, just put your call light on if you do need something. Okay, so this video is just to kind of go over the different types of oxygen delivery devices and explain a little bit about each one of those. And as with anything, before we ever do anything, we would have checked our doctor's orders, so we've checked the oxygen, we've done our 5 rides, all that kind of stuff. I'm just going to be demonstrating the different types of masks and talking a little bit about them. So in the other video, we talked about the nasal cannula, okay? And again, you're going to usually see 1 to 6 liters per minute with the nasal cannula. And it's the only one that we can connect to our humidification. And again, this is sterile water, and when we connect it, we always want to make sure that it is bubbling, and every time we walk in, we're going to be making sure it's bubbling. But we've checked, we checked the sterility, we date, time, and initialed it. And then again, when according to the policy, when do we, as far as the date time, when do we need to change it, but also when it gets down to, it says this level down here, it says to replace. So if that happens before the time runs out, we would need to replace it. Again, that's going to be a policy. And again, we're always making sure that this is bubbling. And so with this, you're always going to use 4 liters or more with the nasal cannula, okay? And that's typically the only time that you're going to be using that, okay? These other ones, I'm going to go ahead and put some gloves on. I not necessarily have to, but I'm going to show you on one of them. So this one is the simple mask. And the simple mask, and so I've done my medical hand wash. The simple mask is basically just a simple mask, okay? And so it just has this right here, the little holes right here. That's where the air from room air is coming in as the patient breathes. The room air is coming in. The oxygen is actually coming out through here, okay? And with any of these masks, again, we would have it connected to our oxygen device, and with a simple mask you can use 5 to 10 liters per minute, okay, and that's going to be determined by what the order says. So I would have this, again, the oxygen would be flowing, and with this one, because of the mask, with the nasal cannula, we were checking the nose, the skin integrity. Well, we want it, because this is going to be tight fitting over the nose and under the chin, so that would be somewhere else where we would be looking for. So you want to make sure that this is fitting properly. So We would put this over the nose, that goes here. It's going to go back behind the head, okay? So again, where those straps are, and even on the back side of the head, would be some skin integrity places that we would need to watch for, okay? So this has got to be tight feeling. So sometimes if your patient is a mouth breather and they're not getting the oxygen, they may put a simple mask on, okay? And this one, you've really got to make sure, so if they're retching or having nausea and vomiting or gagging, we would need to make sure we pay attention to that. The only thing about this one is that whenever they have to take it off to eat, and so a lot of times I've seen patients that had this on and their oxygen was sitting at 94%. They took it off just to take a bite and it dropped to 85%. So you've got to make sure you're putting this on and off. They can't just leave it off. So the benefit of this is that they can eat and drink and still get their oxygen. With this one, they would have to take it off as they eat. And so a lot of times I've seen where the oxygen sat drops just from the moment we take it off and then we put it back on. So that's a simple mask, 5 to 10 liters. This one is considered a partial or a partial rebreathing or a non-partial rebreathing. And so the partial, when you look at this, it's kind of like the simple mask, but however, these holes are a little bit bigger. On this side, it is occluded, okay? So that means whenever this patient's taking a breath, there's only room air coming in through here. If it is a non-rebreather, then there would be a seal on this side, so the only thing that they are actually breathing is oxygen, okay? So I want to show you, so we need to make sure with these, if they have a bag, they've got to stay at least 3/4 full of oxygen, okay? And so these are 10 to 15 liters per minute, whether it's the non-rebreather or the rebreather, okay? But to do this, I'm going to go ahead and turn the oxygen on for just a second. Applying it to the patient is the same as a simple mask. Get that through there. So I'm going to turn this on for just a second. When you connect this, and I would have it set at the 10 to 15. Okay, so I'm going to do it at 11 right now. So before I put this on my patient, I've got to occlude this right here, and you can see that it is filling with oxygen, okay? So that's got to, so I'm put my glove fingers in there, and so I've got this. And so as I put this onto my patient, and if this was a non-rebreather, all they are getting is straight oxygen. We'd have to do a lot of ABGs with this. You don't want to leave this on a patient for very long, especially a COPD person, because the high oxygenation is going to shut down their chemoreceptors for breathing, okay? But once we put it on there, this is going to kind of go up and down as the patient's breathing. We want to make sure it stays at least, we want to make sure it stays at least 3/4 full while it's on the patient. If it collapses, then, and they're still breathing, what are they breathing? They're breathing their own carbon dioxide, and so that could be hazardous too. So you're always checking to make sure that this is 3/4 full. Okay, so that's the non-rebreather and the partial rebreather. Depending on if you've got one, it's a partial. If it's got both, then it's a full non-rebreather. Okay, I'll get that in a minute. You have your tent, your oxygen tent. And so with this one, as we were talking about in the other video, this is the one that's got the bigger tubing on it. And so this is one, and it's going to have a lot of humidity, because a lot of times they'll do respiratory meds where you'll see it just fogging up, and So there's a lot of humidity that could accumulate. So the water can accumulate in these right here, so you gotta really pay attention to those. So with the face tent, this one is 8 to 10 liters per minute. And with this one, the small end is what goes underneath the chin, okay? So this would go underneath the chin, and this is going to be over the head, okay? And so you're gonna see a lot of humidity coming up through here, okay? And so the smaller part goes underneath the chin, and this is open, and so it's doing a lot of humidification. So again, with any of these, you're gonna be checking the skin integrity wherever this is, and even on the back of the head. So that is a face tent. This other one, the last one we're going to talk about, is called the Venturi. The Venturi is the most precise, and so a lot of times you'll see patients that are coming off vents put on a Venturi. And so the Venturi is usually 4 to 10 liters per minute, which gives a 24 to 50% oxygen. So according to the ABGs, we need to have, this patient needs to have 26% oxygen to maintain that. So we've got several little different deals on here. So I'm looking for, so this one says 6 liters per minute gives me 31%. So they're different sizes, okay? And so with 6 liters, when I put this on my patient, okay, they're mixing some room air in here, okay, and even through these little deals right here. But if I set this at 6 liters, it's going to give me 31%. Well, we needed more than that. This particular one says that it's 4 liters and it gives 28%. Okay, and I'm reading right down here on the end. This one is, get the light right, 8 liters, and it gives me 35%. So I'm going to read all of these to tell me which one I need, because the doctor may say he wants 35%, then I need to know which adapter I need to connect here. And so you just pop that off, put that on there, connect the correct one, put that back on there. It's already connected to the oxygen before we place it onto our patient, okay? This is another Venturi, and like I said, it's precise. It is a little bit different here, and so you've got to know whatever the manufacturing or what respiratory has. So on this particular one, I can dial it to where I want. So there's an arrow right here, and it says 50%. So when I do 50%, okay, it says 6 liters, and if I've got it stuck right there, then, because it's got a little line here, so when I've got this flowing at 6 liters, and I've got my little arrow here, then my patient is getting 50%. And you can see that it is closing this right here. So as I'm moving this to the different ones, it's opening this area right here. So as I turn it, it's getting, so when it's completely right there, that arrow is showing that it is at 31%, and it shows that I should be having my liters per minute on 3 liters per minute. And again, you can see this opening and closing, and again, it shows, so I've got 24, 26, 28, 31 with 3 liters per minute. For 6 liters per minute, it's going to give me 50%, 40%, or 35%. And again, we would have these connected. We would do our 5 rights, 3 checks. We would set this, or make sure we have this as we're doing our rights in there. And so those are the different types of oxygen devices that you're going to see in there. And I'll go ahead and put that up. And of course, we would get a new one, trash that one for our patient. So just other different types of oxygen devices. And so again, with these, you got to make sure it's tight and fit. This goes over the nose. You would check for the skin integrity with each one of those, where the straps are on the back of the head as well, because we're laying flat. They're up against that, so it could cause a pressure ulcer on there. And so that is on that, and of course, you know, you're always going to do, I don't necessarily, because we're just talking about it, but a medical hand wash, because I took my gloves off. And so you would want to have gloves on when you are filling this up, so your hands aren't just, your fingers aren't over the area there to occlude, to fill the bag up. Okay, so that is just your different types of oxygen devices, delivery devices, and so, okay.